In any type of healthcare organization, the integration of third-party apps can make you or break you, and how well that digital solution will integrate. Granted, with enough time and money, you can make many things work. But when you're doing a digital transformation in a matter of months, which is really the pace which most of us are going now, versus years of kind of playing with ROI and fit and interfaces, et cetera, you really need to be pretty clear that it's going to integrate very easily.
Welcome to the Big Unlock Podcast, your leading source for insights and best practices on the digital transformation of healthcare. Join host Patty Patmanaban, CEO of Damo Consulting and best-selling author of Healthcare Digital Transformation, How Consumerism, Technology, and Pandemic Are Accelerating the Future, in conversation with healthcare and technology leaders.
Hello, everyone, and welcome back to my podcast. It is my great privilege and honor to introduce my special guest today, Ray Lowe, SVP and CIO of AltaMed in California. Ray, thank you so much for setting aside the time and welcome to the show.
Patty, thank you for including me today.
Thank you so much for that. So, Ray, why don't we jump in and maybe for the benefit of our listeners, if you tell us a little bit about AltaMed Health and the patient populations that you serve.
Sure, I'd be delighted to. So I'm Raymond Lowe. I'm the CIO and Senior Vice President for AltaMed Health Services. I've been with the organization for 3 years, and in this time period, we actually have completed a complete digital overhaul of the enterprise, including technology, applications, patient engagements. More importantly, who AltaMed is we actually serve over 300,000 patients at over 50 locations in the greater Los Angeles and Orange County areas with over 1 million visits per year. We provide services to the Medicaid, underserved populations that are primarily Latino and multi-ethnic, and many of those are 200% below the poverty level and 40% are pediatrics. Some of our services include primary care services, women's services, pediatrics, HIV/AIDS, outreach. We also have programs for all-inclusive care of the elderly. And we also have 2 other companies. One is the AltaMed Health Network, which is a restricted Knox-Keene, again, focusing on Medicaid insurance product, as well as a managed care organization known as Altura.
Thank you for that background. Now, I am obviously very, very interested in learning about the complete digital overhaul that you referred to, and that will be the focus of our conversation. Before we jump into the digital transformation journey at AltaMed, I just wanted to touch on one thing. I understand AltaMed is also a pioneer in the use of the patient-centered medical home concept, the PCMH concept. Could you care to talk a little bit about that experience and how that has worked for your population?
Sure. So, as you stated, PCMH, or patient-centered medical home, AltaMed actually started this in 2011, so we have a bit of time working on this. We started with our pediatrics populations in joint cooperation with Children's Hospital Los Angeles, and we also utilize the PCMH approach on our senior services. At its core, what PCMH is, it's a way of coordinating care for our patients. It also means adjusting our processes and care efforts to treat the whole person. Within our PACE program, we have nurses that manage patients, ensuring they receive regular treatments, required medical equipment, special referrals, and other type of clinically related activities. But we also provide PT, OT, dental, and socializations to help them vibrant. And we expand this even further, including interdisciplinary care, which is our social aspects, and social determinants of health. So for our PACE seniors, our teams work to address both the clinical, the social, the interdisciplinary, and any type of SCOH things that can impact them and their overall well-being.
So you've been practicing this since 2011, so you would have been one of the pioneers in the concept. So I imagine that you have a wealth of data and you're utilizing that to drive improved outcomes for your population. And we certainly want to get into that as well. So you mentioned, Ray, that you're now coming out of a 3-year digital transformation, digital overhaul, as you mentioned it. Can you tell us a little bit about that? What were the top priority areas for that program, and what kind of programs are currently operational at AltaMed?
Yeah, so our priority is really providing quality care without exception. And from a digital health perspective, that really means patient-centric care where, when, and how they want it. AltaMed provides care for essential workers. Many of them, again, are low income and underserved communities. And this is a patient population that has been inadvertently left behind, I would say, due to the digital divide that does exist out there. And so as we plan our strategy, first and foremost, we want to have a mobile-first strategy that provides care with flexible walls, both inside and outside of our brick and mortar facilities. The second thing that we do with our digital health strategy is that we leverage our Epic MyChart. We call it My AltaMed Portal for patient interaction and messaging. We went live with Epic in October of 2019 in a 10-month implementation cycle. And the interesting thing is we were barely 5 months from our go live when the pandemic hit. And the digital solutions that we built, telehealth, remote patient monitoring, patient engagement strategies, those are all centered around My AltaMed and the MyChart of Epic so that we can have the rich clinical information and stay in good contact with our patients around there. You also got to think in March of last year, if we draw that as a starting date, we had on our roadmap the virtual health, the televisits, and RPM. And my dyad partner and I, we were evaluating who would be possible candidates that we should be looking at. And for instance, on the RPM side, you have Vivify, Livongo, Vitaltech, McKesson, and other ones that we were having conversations with, but we had not selected one. And then even in terms of the televideo, we're making and having conversations with American Well, VidYO, Cisco Extended Care, and others really to find out what would be the right solution for the organization. So in our digital journey, right, we learned quickly, again, through the pandemic, that we had to be able to deliver a televideo platform around that. The third area we're looking at is transitions of care and managing our patients in the hospitals, beyond our hospitalists and case management. This is all about data interchange, and being able to mine the data so that we can actually have timely data and we can do the proper clinical interventions. A fourth area we're looking at would be in our women's services and their pregnancy journeys. What is the type of handheld app that can help on the mother-baby journey, be it Baby Scripts, be it Mommy or others that help our pregnant moms as they're going through their different trimesters and their wellness checks. And then again, expanding our care beyond the walls for our PACE participants. The pandemic, has really reduced the amount of participants that can actually come to our PACE centers. And so we're looking at how do we continue to have these seniors be vibrant, receive the same amount of care in a technology supported method. And often you're dealing now with a population that may not be the most technically savvy. We want to make sure that they are not afraid of the technology, know how to use it. And lastly, again, looking at the SDOH aspects on the care and helping our patients access the services.
Well, that sounds like a really comprehensive digital transformation roadmap, Ray. You covered pretty much everything that would be considered a high impact area. So you talked about telehealth, you talked about remote monitoring, and mobile applications for your populations. The question that comes to my mind is, you mentioned that you serve predominantly low-income populations, and you also mentioned that there is the digital divide that is out there. So in that context, what kind of unique capabilities or unique enablement do you have to plan for and put in place for your populations to get the same access to care and same quality of care as anyone else?
Yeah, you really hit the nail on the head. That's one of our most significant challenges, an area that AltaMed strives, which is to be culturally sensitive. Rather, the majority of our patients are Spanish speaking. They may only have a third or fourth grade education. So how do you communicate with them? When you start even at the top with Epic Systems in Verona, Wisconsin, as we launched our My AltaMed MyChart, Our cultural linguistic folks, they no go the Spanish translation. And so we work jointly with Epic to really enrich the Spanish translation so that users can understand it more easily. Again, we are working here in East Los Angeles, a very heavy Latino area, versus folks in Madison that may have more of a Google translation of Spanish, but that's a big key area around there. The other thing that we're seeing as, again, in our mobile approach is, there are a lot of folks building apps out there that may work on, say an iPhone 10 or something new, or maybe an iPhone 8. But when you're dealing with the underserved and low income, oftentimes they may not have that latest iOS system. They may have a 6, they may have a 4. It's good enough because they can't afford to get a new iPhone or it does the job. With this patient population, they're making decisions on whether they pay their cellular bill, or whether they're putting, food on the table for them, and the real decisions they have to make every day in terms of how they spend their valuable dollars. So when we look at the technology solutions, we actually require the language diversity, backward compatibility, on different type of iOS systems and ease of use. And you would really be amazed how many folks don't think about that as they're delivering and bringing things to market.
Wow, that is something that is really counterintuitive, having to plan for backward compatibility. And a lot of us are looking at the next version of the iPhone as opposed to an iPhone that is 3 or 4 generations ago. But it's a very real problem that you've described. And I think this is what healthcare is all about, making sure that it's inclusive and it serves the needs of all populations, right? You talked about a lot of technology choices here. You've talked in your earlier comments, you talked about all the different platforms that you were considering, Livongo and so on. When you assess your technology partnerships and your technology choices for implementing your digital programs for your population, what are you looking for? What are the top 2 or 3 things that drive your decisions, especially as it relates to, let's say, digital front door tools, mobile apps, and engaging with your populations?
Yeah, so we rely heavily upon Epic through either the user groups or what we're seeing in the app orchard. Epic is really so strong at sharing the best practices. We're able to learn from UPMC, we're able to learn from Cleveland Clinic, Kaiser, Stanford in terms of their journeys, and they make that available. So your learning can be faster because they've proven what technologies can work. Speaking more about the app orchard, in any type of healthcare organization, the integration of third-party apps can make you or break you. And how well that digital solution will integrate. Granted, with enough time and money, you can make many things work. But when you're doing a digital transformation in a matter of months, which is really the pace which most of us are going now, versus years of kind of playing with ROI and fit and interfaces, et cetera, you really need to be pretty clear that it's going to integrate very easily, right? Stacking them together just like Legos so that you can turn something on in a couple of months versus looking at maybe 6 months or 8 months. And part of innovation is failing quickly, right? So you can learn around that. And by taking that approach, you can easily see the results before you're so committed to a program or to an approach. The other things we're kind of evaluating as well, there's more, Patty, we're looking at, right, is, e-consult platforms are really becoming very interesting right now in terms of how we help our providers. And we're looking also at ambient voice for provider productivity and ease of use. And then on the patient side, again, kind of looking at our elders and some of the other areas is, can we extend tablets out to them that they'll find that they're easy to use, right? And again, kind of erasing that inherent digital divide so that they can be connected, electronically to AltaMed.
One question that comes to mind when you talk about just this range of digital solutions that you're trying to implement is, how do they pay for themselves? There is a reimbursement component to it. There's an ROI component to it. And obviously there's a cost component to it for the patients as well in terms of the devices or bandwidth access, a range of other things. How do you go about looking at this from a business case standpoint?
That's a great question because, you need to look at why are we innovating? What is the business outcome? There may not always be a financial reason, a financial payback. And when you look at the quality and doing what's right by the patient. And so that by extending solutions to them, it's the right thing to do. Honestly, I would say, again, we went live in October of 2019. And before that, if you wanted to come to AltaMed as an essential worker, you'd have to take a day off for you or a loved one. You may have to take multiple buses to come in. You could not register, et cetera. And you look in 2021 in January, and we offer both, telephonic or televideo visits with the ability to bring in language translation services, to the mom with that kid that could be sick, or somebody with a URI, which is, very prevalent. People are very concerned and able to address those needs. So that's really about doing the right thing for the patient. Because I can't imagine, right? Nobody wants to go into a hospital and nobody really wants to go into a clinic, but yet you still can provide that care for the patient at the right time. So I look at a lot of that ROI is what's the right thing we need to do by the patient? How do we need to do about quality as well? You mentioned reimbursement. That's always a tricky topic because now we're talking about the feds and how the CMS guidelines are reimbursing or not reimbursing. And that gets somewhat complex. It does affect timing sometimes in terms of what you do introduce for your digital solutions. But I think ultimately keeping what's at the best interest of the patient is where we need to be. And I think the other part of it is when you're implementing, again, you need to understand what is the provider workflow change going to look like and what will the patient look like. You can put in some very cool digital tools, but if it's not adopted, you won't be successful with the outcomes you need.
That leads us to obviously the big question, how do you get people to adopt it? And at this point, we're not just talking about patients, but we're also talking about caregivers. What kind of training, what kind of enablement do they need? And how do you make them change their workflows or their daily patterns and so on? This is not new to you. This is a universal challenge across all of healthcare. Can you talk about one or two things that you consider as successes in this regard in driving adoption?
Yeah, so I can use a language and I can use a televideo as both examples because they're all very new. Again, if we go back to, it was April 8th of 2020 that the CEO came to me and said, give me a video solution. And I'm like, gee whiz, right? We didn't even have anything, instantiated. And then, CMS was dropping their HIPAA requirements. It was making it much more open. You could do FaceTime video, other areas to address it. But we wanted to make sure we took, still a HIPAA compliant approach so we didn't expose any PHI accidentally or put anybody in a breach type of position. So we actually selected two, which was Doxy and Doximity, which is widely used in healthcare with an eye towards a long-term solution, which would be integrated with Epic, launching out of Epic, et cetera, around there. It's a change moment, right? We got it to work. We created the correct flows and templates inside of Epic. We trained the providers, and yet there was a lot of confusion because they really didn't know, and patients didn't understand, I'm supposed to click here, I'm going into a black room. It was really very challenging, right, in terms of driving the adoption. So what we did is we reset and we created a digital center of excellence within two of our clinics where they would primarily focus in around the televideo experience, including language and other requirements that we would have, so that we got really good at it. And then we were able to share those best practices across the other 200 plus providers in AltaMed so that it's much more standardized. The other thing we did as well is from a training perspective, my training team was certainly conducting a lot of distance training, web training as a norm, and we weren't getting the results. And I said, folks, you need to go meet the providers where they are. And we could do Zoom training, WebEx training all day, right? But they're not quite getting it. So we really, double down, triple down on the hand-to-hand training, with the folks. They had hours working with them in the clinic, so that they're, again, able to be much more comfortable, right, with the usage of the tool.
Yeah, those are very interesting examples. You talk about innovation, you talked about it a few times, and clearly you've accomplished quite a bit within a very short time, given the pandemic and everything, and possibly because of the pandemic and the sense of urgency that created around the implementation of some of these programs. There's the other side of driving innovation rapidly. You referred to it in passing when you talked about failing fast and learning quickly and moving on. So, how do you manage the risks of innovation, especially innovation that comes to you in the form of a solution that's been developed by a digital health startup? And what is your advice to startups who are looking to engage with you and be part of your innovation journey?
Yeah, that's a multi-part question, Patty. So I think I'm actually excited in your book is that from an infrastructure perspective, is it needs to be you need to have a sound foundation in terms that you can go ahead and sprint and look to leverage your technology backbone to deliver these resources. There's so many different network hops or data center processing activities, hosted solutions that can cause many problems to fail.
Technical debt.
A lot of technical debt, right? Yeah. Exactly, out there. Maybe we'll talk a little bit about technical debt. And there was quite a bit of technical debt here. And I remember I heard there was this great quote from Warren Buffett, that when the tide goes out, you discover who's been swimming naked.
Yeah.
You may have heard that one, right?
I've heard that one.
Yeah, I love that quote. And, a lot of folks, I think, that have been ignoring their technology infrastructure, just putting it off, extending the life, they were caught when the tide went out. So, that investment of understanding the life cycle and the technology that you're building, again, we kind of did almost a wholesale upgrade from our data center to our networks that are happening out there. And, part of that is building, really strong partner relationships. I selected, of course, AT&T and heavily with Cisco, NetApp, and partnerships with Presidio, Red 8, and Connection. And I had to leverage those technology partners and their thought leadership where I had gaps in my own team's ability to deliver. But the net sum of the parts just delivered superb results. I like having executive briefing sessions. And again, at Cisco, there's a gal, Catherine Howe, who's the director of their healthcare. And we had an EBC with her. And I was putting all of the Cisco products in. And we went through an exercise where I was actually able to determine for what we wanted to deliver that I had actually made all the right technology choices. And so I was like, okay, turn the afterburners on, we're going to go even faster. And that kind of occurred about at the end of 2019. So that was a good way to start from a technology perspective. But then you ask me, what do you share to startups? What would you tell them? There's so many great ideas and companies that are out there. I manage the risk by having a joint review with my dyad partner, Dr. Eric Lee. He'll look at the clinical expertise and how the workflow is and the experience and what is seen. So we're able to assess it from a clinical perspective. And I look at it from an overall systems perspective, interoperability, security, how it works in the overall ecosystem, whether it's a sound business decision, et cetera, and ideating between the two of us, we really ultimately kind of come up with a very solid solution that we're very confident, as we move ahead. But on the startups, I think they need to have a very clear vision of what problem they are trying to solve. I know that some folks say that they will do RPM primarily for diabetes management and that they're going to be moving to a CHF type platform or COPD or other type of chronic disease states. I appreciate that honesty, right? They tell me what they're really good at and where they're going to, so I know where to baseline from. Where I get a little more perplexed is when they'll tell you they can do it all, also known as advertising, but not as design. I think is a word they say. That's very disappointing. And then when people also underestimate, the integration activities, or they don't have good technical resources, right, to make it easy for the health system to ingest the product and start getting results, because ultimately you want us to be your evangelists of why this product is the best thing sliced bread, and this is the outcome of what we'd be able to achieve by them.
Yeah, I think that's great advice to startups. I wanted to touch on one other topic, Ray. This is to do with the governance model. You mentioned that you have a clinician partner with whom you work very closely in determining how to roll out these programs, what programs to roll out, and how to roll them out, and what kind of technology foundation you need to have in place, and so on. Can you talk a little bit more about your governance model? What is the governance structure for driving these initiatives? Do you have a board level, C-level approval? How do you prioritize? Can you talk a little bit about how do you fund it? How do you prioritize it and implement? Can you talk a little bit about your governance model?
Sure, I'd be happy to. The term digital is a very broad term.
Right.
Yeah, it really is very broad, right? Depending on who you talk to, it means different things. And, fortunately at AltaMed, we do have a structured governance process. It's overseen by our executive governance leadership committee, which I'm a member of. It's basically the C-suite where key decisions are made. But then, I look at there's really, 4 areas that you drill down into. One part of it is the digital engagement or the patient front door, which is your website, your social media, your CRM, patient engagement activities. Another key area, of course, is going to be your clinical digital, which is tied to your EMR and the related applications and how that's working. Again, we try to leverage as much as we can out of Epic and the MyChart as versus looking at third-party apps that have to bolt on, because Epic is very rich. The technical digitalization, which many of the hardware vendors also want to talk to you about on the data center and hyperconverged and SD-WAN, those are managed primarily under my direct purview. And then as you look at innovation and disruptive areas, and this is, business strategic oversight with, as I spoke earlier on women health, RPM, and how we can leverage other type of e-services. So each of these, 4 contribute to digital. I may have left out a few other areas that are out there, but to me, I kind of like to keep a top 10 list that I review with the CEO so that I stay aligned with the CEO's plans of what we're supposed to be executing. The budgeting and prioritization is an art. There are lots of asks that come up, and there are lots of shiny coins that are thrown out there. But again, through maintaining focus on one of those top 10s, and if other things come up, perhaps we can fit them in under a sub-project of one of those top 10s. But as you look at something with a significant investment, we look at what is the total cost of ownership, what's the ROI, and what are the KPIs that we will be achieving, and are we going to be achieving those? For a very large investment, say over 10 million, we may bring in outside consulting to help us vet through it, so we really understand how we're going to be achieving those type of KPIs. But it ultimately has to make good business sense, good financial sense, and we really should not be doing technology just for technology purposes. We need to have a strict business outcome to it.
Right, that's very comprehensive. We're almost out of time here. I want to ask you just one final question here. If there's one best practice from your experience with digital transformation at AltaMed that you would like to share with your peers, what would that be?
Patty, I would say this. I'm at late in my journey on this. And as I've been able to review your guys' book, it's really good.
Thank you.
It lays out the steps, the technology, the approach. So I think if you're trying to figure out where and how to go on your digital journey, if you use your book as a reference, it will be very helpful. And the second part of that is, again, you need to have a solid understanding once the solution is implemented, that you keep both a provider and a patient-centric view. You cannot keep an IT view, because that will ease the adoption and accelerate the overall benefits.
Yeah, don't make it an IT project, right?
Correct. That's correct.
Ray, thank you so much for those kind comments about the book, and I will be sure to pass these on to Ed as well. Well, Ray, I guess we're going to have to leave it there for today. It's been such a fascinating conversation, and thank you so much for taking the time to share your experience, your insights, your best practices. And I look forward to following all your successes going forward.
Thank you. Thank you for including me today. I really enjoyed our time.
We hope you enjoyed this podcast. You can reach us at info@thebigunlock.com with your feedback and questions. This podcast is brought to you with the support of our partner, Powbox. Secure email for modern healthcare right out of the box.